Hello, thank you for checking out our program, Saving Souls, Healing Bodies, Faith-Based HIV Outreach. I'm Tabitha Washington with DKB Med, and I'm so glad that you took the time to join us to learn more about this great program. And now I'm going to turn it over to our faculty for this program, Dr. Corey Joseph Abair, Assistant Professor for LSU Health Sciences Center in New Orleans and Chief Medical Correspondent for WWL-TV CBS Television.
All right, thank you, Tabitha, so much, because we know that the African-American pastor and the African-American church, they're the cornerstones of our community. They have been, and they will always be. So at this point, we have to remember that we need you. We need you to be able to wrap your arms around this community and be able to deliver the information as we know that only you can. I mean, you educate your congregants on all the things that need to be included in the tapestry of our community. So, we will help and you will help improve their quality of life by the information that we're going to be giving today. So there's some facts that we just have to wrap our minds around, folks. I mean, there are 1.2 million people in the United States living with HIV. There are 432,000 African Americans, and 13% of African American people with HIV are unaware of their diagnosis. This is unacceptable. You cannot get treatment. You cannot be able to move forward unless you know that you have the diagnosis. And we historically don't want to know. We're scared, but we got to do better. And 36,000 new cases are annual, and that's 41% African-American people are 36,000 cases annually. And men account for 76% of those African-American folks. And those numbers are staggering, and we just cannot have that any longer. African-American individuals are 8 times more likely than white individuals to be diagnosed with HIV. Do you know what that looks like, folks? Look at the rates per 100,000 right here. Overall, it's 13.2. But if you look at the African American population, it's 45.5, and the Hispanic population all the way through down to the Asian population. So you have to remember that if you're 8 times more likely than white individual to be diagnosed with HIV, that means that the amount of new infection and the amount of risk that's out there for the African-American population is extremely high. So we have to do something in our faith-based group to address this situation. It's an emergency. So if we look at the lifetime risk of HIV in the African-American population, it looks similar to the data that I just showed you. Look at the Black men, 1 in 27. 1 in 27, but when you go to Hispanic men, it's 1 in 50, and white men, 1 in 171. And that is a horrible statistic. But if you look at the African-American women, 1 in 75, Hispanic women, 1 in 287, but white women, 1 in 874. Okay, so if you look at that and you see 1 in 75 and 1 in 874, you just, it takes you to a place where you're like, what is happening out here? Which is why I'm sounding the alarm for this emergent situation that we have. We know there are racial disparities, inequities in care. I always say inequities because when we say disparities, it kind of lets people know what we're talking about. But I like to formalize that by saying inequities, because disparities, those things are just different. So the weather in Miami, there's a disparity between that and the weather in Alaska, but that doesn't mean that the weather in Alaska is bad. It just means that the weather in Alaska is different. But this is not what healthcare is. It is literally that African-American healthcare is bad and other people's healthcare is good. So we have to call it inequality. We're less likely to receive care if we have HIV and less likely to have viral suppression. So when you have those two things working together against us, then we're in a real hole that we have to climb ourselves out of. We know that through pop culture that HIV is spread very differently in the male population, African Americans, as opposed to the female population. So when you look at this slide, you'll see that 0.82, that is male to male sex, that's 82%. And 0.15, that's 15%, that is heterosexual sex. But when you look at this slide on the right side, you'll see that the female, the percentage of heterosexual sex in HIV transmission is 91%, 0.91. And injection use sex is 0.08, which is 8%. So what we're looking at here is a huge difference between how men and women have HIV spread in the African American population. Here in the New Orleans metro area, we have Jefferson Parish and we have Orleans Parish. So when you look at the diagnoses by age, folks, you'll look at all of the numbers and you'll see what the issue is here. And more than half of the new diagnoses are people 13 to 34 years of age. I diagnosed a patient very recently that was 15 years of age that had a new diagnosis of HIV. So, when we start looking at, the churches and the outreach folks, this is where taking care of the entire family. This is where you come into play, because you have to make sure that you cradle our population so that we can make sure that we can decrease these numbers, especially in that very fragile age group. So once again, though, when we look at our region here, we look at Jefferson Parish and Orleans Parish, look at Black, Hispanic, and white, you see this. This is 2021 data. 2/3 or more of new diagnoses are in the Black individuals between Jefferson Parish and Orleans Parish. So, this is not something that's just happening, right in Orleans. This is something that's happening in our metro area. So we have to address it in churches, and all of this outreach has to be in both of those areas. So when we, look at prevention and treatment, folks, I need you to be able to dig deep in this one, because there's a lot of issues that are going to confront you, and a lot of folks that are going to be in your congregation that are going to say, I think this is not right. I think this goes against all the social mores that we deal with here in our congregation. It goes against all the spiritual things that we're taught. But we have to get a little bit past that, because people need to be tested. We need to prevent this infection. Okay, so the testing is recommended for everybody. People don't like to know. People don't like to know things, but testing is for everybody. It's simple. It takes a few minutes. So you can prevent this. The way we prevent it is with PrEP, and that's pre-exposure prophylaxis. Now, 1 pill a day or bi-monthly injections of PrEP can really change the outlook of our community for HIV infection. 1 pill a day, that's all it takes, right? It's 99% effective. Not 100, but not 50. We're talking almost 100% effective in reducing HIV transmission via sex. It does not prevent other sexually transmitted infections, and the condoms are very effective. But please remember that almost 100% of these infections can be prevented. And when we treat HIV, we have very effective treatment. I mean, people always talk about Magic Johnson. Magic Johnson, he is thriving, doing well. Everybody thought that was a death sentence for him, but we have learned now that HIV is not a death sentence, but you got to treat it. The medicines are effective, easy to take. 1 pill a day for most people, or bi-monthly injections, can just help you live with this in a way that your quality of life is the same. People living with HIV can live nearly as long as people without HIV, and treatment can also prevent transmission of HIV across the board. This is one of the slides that hits home for me and just hurts me to my core, and I'm sure it'll hurt you too. Who is using PrEP? So it means who is being able to prevent? What group? All right, only 11% of individuals who could benefit from PrEP were prescribed PrEP in 2021. 11%, and when you look at the white population, it's 80%. So 80% of white people that can use PrEP are using it to prevent, and only 11% of African Americans are using it. And I showed you the data to show you what was the infection rate. 8 times more likely to be infected, but only 11% are using it to be preventive, and actually trying to get to the point where we can not have this in our community. So we've got to do better, and that's where you come in. You have to end this epidemic. And so, pastors, I'm putting the word out. I'm putting the word out across your congregation. And it's not just pastors. It's the entire health ministry. You can end this epidemic. You can end it. I mean, we did a lot for COVID. We wore masks. Some of y'all are still wearing masks, and that's good too, because when I'm on an airplane, I wear a mask. And I'm in close quarters, I wear a mask. But we got together. We bound ourselves together for a common cause to prevent this. But this is not COVID. This has a lot more stigma in your community, and you have to get past it. I know you got to dig deep, but New Orleans has one of the highest rates of HIV infection in the United States, one of the highest, and that's our people. African American churches, you have been the place where people go to be healed and to seek refuge. You may not agree with the lifestyle, okay, but it doesn't matter. But let's be clear here. You don't agree with the drug dealer's lifestyle, but if a drug dealer comes in that church on IV medication, you'll take him in. You'll do that. Take her in and get them through it, because there's not a lot of that type of stigma attached with IV drug use. But when you start talking about some other behaviors, then that's where the stigma is attached, folks. And that's why we've got to do this. And I know it's tough, but you got to do this, right? Everyone should be tested, and HIV can be prevented with PrEP and other methods, and it can be treated. You have to remember that you are the cradle. You are the cradle to be able to make this happen. By stopping HIV, U equals you. Undetectable equals untransmissible, okay? So we have to remember, if you don't detect it, you can't spread it. Okay, successful treatment with antiviral medication makes it impossible for the virus to be transmitted to others. Now, in medicine, it's hard to say the words impossible, okay? But it's bold here because it is impossible. And we've got to do it in a way that it'll make people feel comfortable to get tested, and then to get treated. Because if we can get those levels low, then that's a Magic Johnson situation. Then you live a long time, and you can't pass it on to your family. So we have these faith-based initiatives that are going to be across the United States, all over. And this is not just this particular program, but we are going to have these in New Orleans and the metro area all over. So we have to stop HIV, and U equals you. Okay, now that sounds like, kind of kitschy. I understand it but it's something that you can remember, because undetectable equals untransmissible. That's the Magic Johnson phenomenon. That means that if you can treat this, if you could prevent this, then it is impossible for the virus to be transmitted to others. So we don't like to say impossible in medicine, but we can say that. Okay, so it removes the stigma associated with the testing, because if we can get these numbers down, then you can know that if you have this, you're going to be okay if you do the things that we ask, right? Whether a person is positive or negative test result, ongoing support and engagement is necessary to prevent or treat HIV. So U equals you. Undetectable equals untransmissible. You've got to remember that one. So because we know that outreach is very important, we're going to have this education outreach across this entire region. Okay, we're doing this summer. It's going to be 4 health fairs. We're going to look at hypertension, diabetes, HIV, because a lot of things kill the African American community. I mean, number one killer is heart disease. We know that, and that's not just the African American community. That's everybody. However, we're going to do all those things, get prostate screening, all these types of things. But the issue is that we're going to be educating on HIV, and knowledge is power. If you know better, you got to do better. And that's what we're aiming for here, so you can know better, so that you can equal you, right? We're going to provide all the additional resources, and we're going to give you linking to the care that you need. So we're going to link you up with a primary care person. So you need to be seen so that you can know if you have another illness or not, right? And we're going to educate this area, the healthcare population across this area, about HIV and how to treat it. Because even though we're talking about you educating everybody, there's some clinicians out there that don't feel comfortable treating this. And that's something we got to get over to. It's all about stigma. So what can you do, really? The first thing you can do is open your mind. You got to open your mind, folks. You got to know that we're moving into a place where you're going to have to know these words. You're going to have to know what trans means. You're going to have to know what MSM means. You're going to have to know about, all this lingo. You got to know it, and you got to talk about it, because there are people in your congregation that are dealing with this every day. And every day that they're ostracized, every day that they can't tell you, every day that they feel uncomfortable, that's another day that you're going to lose someone to this disease. And that's something that you shouldn't want for many reasons. But the number one reason is that you are a person of the Lord, and you know that you have to embrace everyone. You have to love everyone. You have to respect everyone. Also, I want you to make sure you, as you talk to everybody, I want you to refer them to these health fairs, folks, because these health fairs are going to be comprehensive and they're going to save some lives. I'm also going to ask you something that you might not feel comfortable with again. I've had my boots on the ground for you. You know, I've done everything that this community has asked me to do. So there's some things I'm asking you to do now. I need you to help people get PrEP. I need you to help people get this preventive medicine that only 11% of people available that have it are using it. I need you to do this, okay? And they have all these QR codes. You see them on everything. Most insurance plans will cover this. State Medicaid programs cover this. You may have to get prior authorization, which, from your doctor, which I know you know what that means. I don't like it as a doctor. I got to do some extra stuff to actually make sure you get the medicine. I'm working on that legislatively, so that won't happen with certain drugs. However, the QR code scan, I need people, and give them these QR codes, okay? You might even want to everybody turn their heads. So if somebody raised their hand or raises their phone to get the QR code, they won't be judged. But to get these QR codes to everyone that needs them. So with that being said, folks, I'm going to open this up for some questions. And I know you might have some, but this is what I need you to do. I need you to step up. I need you to step out. I need you to go against those little feelings sometimes that you've had that this population doesn't deserve, or they're sinning and all these things. I need you to step outside of that box. I need you to bring them in. I need you to do what the godly thing to save a community, because we're losing folks every day.
Thanks for watching. If you have any questions about this program or how you can be more involved with our upcoming health fairs, please email us at hivoutreach@dkbmed.com. Thank you again for watching.